Hola, muy buenos días
Good morning. Welcome to this press briefing that takes place weekly at PAHO on the COVID-19 pandemic in the region of the Americas. Today, Wednesday, May 19, 2021. My name is Sebastián Aliel from the Communication Department of PAHO, and our briefing session will last an hour. We have received your questions by email, and you will be able to ask the questions through the Q&A button in the lower portion of your screens. Please remember to always include your name and medium when you send your questions. Also, let me remind you that we have simultaneous interpretation to English, Portuguese, French, and Spanish, and you can opt for any one of those by clicking on the interpretation button today. Dr. Carissa Etienne, director of the Pan American Health Organization, will talk about the evolution of the pandemic in the region and the um, production and manufacture of vaccines and medical products in the region of the Americas. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Garta, Director of the Department of Health Emergencies of PAHO, and Dr. Sylvain Aldeguer, Incident Manager for COVID-19 in PAHO. Now, I would like to invite Dr. Etienne to share her remarks for this session. Dr. Etienne, over to you.
Good morning, and thank you for joining today's press briefing. Last week, there were over 1.2 million new COVID cases and 31,000 deaths reported in the Americas. We've seen COVID infections drop throughout the region in the last month, offering some reprieve to our beleaguered health systems. But 3 out of the 5 countries in the world with the highest numbers of new infections are in the Americas. And many Caribbean islands like the Bahamas, Haiti, and Trinidad and Tobago are seeing COVID deaths double in the last week. Canada has registered a tripling of cases in Nova Scotia, Newfoundland, and its Northwest Territories as hospitalizations across the country are on the rise. Costa Rica, Panama, and parts of Honduras are reporting sharp rises in new infections. Infections are also on the rise in Bolivia and French Guiana. In Brazil, we see a pause in the decreasing trends that were observed during the previous weeks. And despite overall reductions in most South American countries, some hotspots in Argentina and Uruguay saw a doubling of cases and deaths in the last week. ICU occupancy rates remain at 90% in many areas of Brazil and Colombia, a sign that these communities are still at a high risk of not getting the care that they need. But the most dramatic change has been in the US, where today almost half of Americans have received at least one COVID vaccine dose, and nearly 85% of those over the age of 85 are fully protected. This widespread coverage has led to a sharp reduction in US COVID infections, deaths, and hospitalizations. The progress that we're seeing in the US is a testament to the power of safe and effective COVID vaccines, but it underscores the vital importance of accelerating access to vaccines throughout our region so that other countries can fully immunize their own populations. With the help of COVAX, PAHO has delivered more than 12 million COVID vaccine doses to the Americas, with another 770,000 doses en route to countries in Central America and the Caribbean. Over 400 million COVID doses have been administered in our region, although the lion's share of those have been in the US. Indeed, just 3% of Latin Americans have been fully vaccinated against COVID-19. And we still have a long way to go to ensure that everyone is protected. We urgently need more vaccines for Latin America and the Caribbean, a region that has been put to the test severely by this pandemic. The glaring gaps in access to COVID vaccines throughout Latin America and the Caribbean are a symptom of our region's overdependence on imports for essential medical supplies. Less than 4% of medical products in use during the COVID response have come from the region. That means more than 90% have been sourced out of the region. And thanks to export bans, supply chain delays, and lack of purchasing power, our region has struggled to compete for access to personal protective equipment, to oxygen supplies, medicines, and vaccines, which are all vital to the COVID response as our people suffer the consequences. So expanding our regional capacity to manufacture strategic medical supplies, especially vaccines, is a must, both for our people and as a matter of health security. Luckily, we have some of the building blocks to make it happen. Strong academic and research institutions, existing manufacturing capacity, robust regulatory systems, and an effective mechanism of procurement. Argentina, Brazil, Mexico, and Cuba have well-established vaccine manufacturing plants that have helped immunize generations of Latin Americans. Some of these plants are being updated to produce COVID vaccines thanks to technology transfer agreements with manufacturers like AstraZeneca. But meeting our region's needs will require expanding production capacity well beyond what's already planned. We must ramp up production for the entire vaccine value chain, from the ingredients that go into vaccines to the vials and syringes that help us deliver them, without compromising quality. We have 8 national regulatory authorities throughout our region that do have the capacity to oversee this work. This sets our region apart. But we must also look to the future and embrace the promise of mRNA technologies, which, although novel and more expensive, present possibilities beyond COVID vaccines. PAHO is working closely with WHO on its COVID-19 mRNA vaccine technology transfer hub. And we are in discussion with regional partners like the Inter-American Development Bank, the Organization of American States, and our member states to ensure countries interested in expanding their manufacturing capacity have the resources and the support that they need to make it happen. And we're pleased to see countries like Chile, Argentina, Peru, and others already showing interest. We must also lean on our legacy of regional cooperation, because it is impractical to think that any one country could manufacture vaccines from start to finish just to meet the needs of its own population. The cost is simply too high, and sustainability would be at risk. And that's why we're engaging with regional organizations, sub-regional integration mechanisms, and others on policy and regulatory issues, research and development, and the investments we need for a coherent regional system that can make increased capacity a reality in the Americas. For this work, and for this to work, we need scale, a commitment to purchase regional made products, and assurance that products will flow freely and without export bans, even during emergencies. Our revolving fund stands ready to help purchase and deliver these products throughout our region, as we have done for the last 40 years. A regional manufacturing network that builds on our national strengths and that is backed by sustained financial commitments is long overdue. It's also our best hope for a long-term solution because COVID will not be the last virus that tests our health system. And while these investments are urgently needed to support our COVID response, we do know that they will take time. PAHO is committed to coordinating with our member countries and partners to advance a vision of greater self-sufficiency in vaccines and medical products manufacturing in the Americas. But until then, let's remember that this pandemic is not over, and there is still much to do to prevent more cases and save lives. I beg you, do your part.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a
Thank you very much, Dr. Etienne. Now we're going to go to your questions, and please, you can also write on the Q&A, and we are receiving some questions from that too, and please include your name and medium when you ask your questions. First questions that we have today are from Anthony Boal, from Reuters, and from Jasmine Brown from Our News in Bahamas in English. Anthony asks,
the impact be for Latin America of India's vaccine export ban? Y también Jasmine Brown preguntas, will the Bahamas be getting other vaccines besides AstraZeneca, like Johnson & Johnson, Pfizer, etc.? And another question says, what happens if a country rejects AstraZeneca vaccine? When and how will they get other vaccines through COVAX? Dr. Barbosa?
Thank you for these questions. Let me go one by one. The first one about the export ban from the government of India will affect not only Latin America and the Caribbean, but the whole world. Because the Serum Institute of India is one of the main vaccine producers in the world. Serum Institute of India had committed around 1 billion doses with COVAX until 2022. And the Serum Institute of India started deploying vaccines, but in the last 2 months, it was not allowed to export vaccines and to the vaccines that the Institute had signed the contract with COVAX. India is facing a very difficult situation. Now, of course, that we understand that the government of India also wants to have access to vaccines to vaccinate their own population. So now, because this is a very important impact, we have many high-level conversations that are going on from the WHO Director General, from the Gavi Secretariat and others, with the government of India, trying to reach an agreement that at least the government of India could allow a proportion of the vaccines produced by Serum Institute to be deployed to COVAX. So far, we haven't received any information from this conversation. They are still going on. The impact will be important because after these vaccines that we are deploying, the revolving fund is deploying during this month, May and June, to the countries in the region, the vaccines that are deployed to COVAX will need to be split among the countries. So in June, probably every country will have a reduction in the vaccines that they will get through COVAX. Second, if a country refuses to receive the AstraZeneca vaccine now, we don't know when we will have new vaccines arriving in Latin America and the Caribbean. Let me tell you why. We will have in May and June new vaccines from Pfizer being deployed to 12 countries in the region that they have committed to receive vaccines from Pfizer. Some countries in the region, they were not comfortable to receive a vaccine that requests ultra cold chain capacity, but the countries that have accepted to receive the vaccine from Pfizer will start receiving the last week of May and during the month of June. But this is a limited amount. We, after a very tough negotiation with Johnson Johnson, Janssen, UNICEF and PAHO, yesterday reached an agreement. So probably the UNICEF and revolving fund, PAHO's revolving fund are signing the LTA, the contract with Janssen this week yet. But the Janssen will start deploying vaccines through COVAX only in the second semester. So our recommendation is that the country needs to take the vaccine that is available. AstraZeneca vaccine is a EUL vaccine, received the authorization for emergency use from WHO, is being used in many countries, 30 countries in our region, Canada, Mexico, Brazil, Colombia, Peru, and many others. Now we have data from the Public Health England, the Public Health Agency in the UK, showing that the AstraZeneca vaccine has a very good result in terms of providing efficacy, even with only one dose. So the Committee of Safety of Vaccines is that every week has a meeting to review the data. In the last statement about the AstraZeneca vaccine was very clear that the benefits provided by this vaccine outweigh by far the risks of very rare thromboembolic events that were detected. So it's very important to ensure that the vaccines that are being offered to the countries can be received and used, because these vaccines will save lives everywhere. We are in a permanent negotiation with the producers, and when we secure the vaccines and we have the date, the flight, the amount of vaccines, we communicate immediately to the country. But there are a lot of uncertainty. When we follow the news around the world, we see many uncertainties, ban of exportation, technical problems in semi-producers. So I think that we advise that the countries need to take the vaccines that are available and use them to save lives. Thank you.
Gracias, doctor. Las próximas preguntas.
Thank you, doctor. The next few questions are related to the variants. These are from Juan Manuel Nieves from Argentina, from Chinchua, Kellen Romero from El Confidencial, Nicaragua, and Lidia Lopez from La Prensa in Nicaragua. Juan Manuel asks, what is the influence of the Brazil variant in the region, and how many countries has it been detected, and what are its characteristics in terms of transmissibility and fatality rate, and what instrument do you recommend to the countries in the region to mitigate its transmission? And so Kaylee Romero asks about the knowledge we have about genomic surveillance to identify variants in Nicaragua, and what results have you had through those screenings. Dr. Aldeguerri. Thank you, Sebastian, and thank you to the two journalists who have asked these questions. The P1 variant initially identified in Brazil at the end of December of 2020 has been officially reported 2 days ago in 21 countries and territories of the Americas, including countries in North America. While this variant is predominant in Brazil, its detection has been sporadic in most other countries, but with a community transmission mostly in Chile, Peru, and Argentina. While it has been shown that this P1 variant has a higher capacity for transmissibility, there is no evidence to infer that the virus is more aggressive or lethal. However, it is important to recall that when you increase the transmissibility and the number of individuals who are infected, well, there is also an increase of the likelihood of severe cases to appear. regardless of the type of variable, excuse me, a variant that is in circulation, all control measures that we already are familiar with, including use of masks, physical distancing, and now vaccination, continue to be effective measures. And therefore, these measures should be maintained in order to stop transmission and maintain the public health measures that should be complied with very strictly and monitored. Regarding the question from the colleague from Nicaragua, Nicaragua, together with other 25 countries in the Americas, has recently received reagents to do molecular screening through PCR of the three variants of highest concern and the ones that are most widely distributed globally. The variant in the UK, initially detected in UK, the one initially detected in South Africa, and the one we just were discussing, initially detected in Brazil. So these reagents for screening purposes will allow us to efficiently select the best samples to then turn around and do sequencing. And thanks to the genomic surveillance coordinated by PAHO, any country which requires it will have access to the 6 reference laboratories for sequencing that we have in the region. And this, we hope, will lead to increasing information and strict follow-up of trends in the Americas, and also giving data to global databases. I hope I have answered the questions from both colleagues. Thank you. Thank you, Dr. Aldigueri. Next question from Venezuela. Several uh, uh, journalists from Bloomberg, from monotiramos.com, from Fe Alegría, and Ariama Garcia from Crónica no Venezuela. They ask whether PAHO has some idea of how many vaccines have been administered in Venezuela, how many health care workers have been vaccinated, and they also want to know if the payment to the COVAX facility has finally been made. Dr. Ugarte, thank you for your questions. We do not have updated information regarding the progress in vaccination in Venezuela. However, up until the latest information we had available, more than 316,000 doses had been administered to the priority groups, among them healthcare workers. Up to that point, approximately 79% of the vaccine that had arrived in the country had been administered. So we hope that the Ministry of Health will provide the information that has been requested, and information which is used for discussions and work for the National Health Board for vaccine planning. Regarding payments, $101 million have been paid into the COVAX mechanism, and another $18 million are still pending payment, which is a positive piece of news. And we hope that the first COVAX vaccines, if there are no more delays, would arrive in June. The ones available now are the ones that will be available through COVAX, and they will inform Venezuela. For example, Sinopharm vaccine has been recently incorporated among the list of emergency use licensed vaccines by WHO, and this could be one of the vaccines. Some of these vaccines require a type of refrigeration that is being used in Venezuela to use the vaccines from other sources. I would like to underscore that the joint work of all the parties, of all the technical groups and others, needs to be maintained, and it requires transparency in information, timely information, and also contributing additional resources that are being negotiated, not only for full payment of the vaccines and purchasing additional vaccines, but also to implement vaccination campaigns in Venezuela, which is another priority a point not only for us, but for the population in Venezuela. Thank you, Doctor. Now we have several questions about Haiti from Jacqueline Schatz from Miami Herald, Sarah Marsh from Reuters, and from Tony Ewald from Reuters in English. The question is,
COVID hospitalizations and infections are on the rise in Haiti. Can you clarify if indeed Haiti has banned AstraZeneca and has not until now authorized any COVID-19 vaccine, or the reason why they haven't yet received any vaccine? Also, what is the status of the first shipments of vaccines they were supposed to receive by the end of this month? Anthony Waddell pregunta en inglés, is it the only country in Latin America and the Caribbean not to have administered any COVID vaccines yet? Y Sarah Marsh dice, if Haiti had a deadline by which it needed to have fulfilled the requirements to receive its allotment, and if it doesn't meet the deadline, what happens? Dr. Barbosa?
Thank you for the questions. It's understandable the concern related to Haiti. Haiti is one of the priority countries for PAHO. Our country office is working every day with the Ministry of Health to enhance their capacity to respond to COVID-19. We had yesterday a very good news. The president of Haiti has informed that the country will accept the AstraZeneca vaccine. In the past, until last week, they were not, they were still discussing if they want to receive the AstraZeneca vaccine, but yesterday we received the confirmation from the Ministry of Health that Haiti is sending a letter to Gavi, confirming, Gavi is the Secretariat of COVAX facility, confirming that they will receive the 130,000 doses that are available to Haiti. So we are working with the Ministry of Health to supporting them, not only to make this confirmation, but also to review the preparation of the country to deploy these vaccines and to start using this vaccine. This will be very important to support the country. And after receiving the confirmation, we will start the negotiation with the producer in order to have this vaccine deployed as soon as possible to the country. The other question was about if Haiti is the only country that's not using. We know that Haiti is not using yet, and Cuba is using, but in a kind of intervention, experimental study. So this is all the other countries in the region are using the vaccines against COVID-19 from different sources, from bilateral agreements with producers, from donation, and also through COVAX facility. Thank you.
Gracias, doctor. Siguientes preguntas.
Thank you, sir. The next question have to do with the use of ivermectin, Bennett Roach from the Montserrat Reporter, and also Manuel Lino Gonzalez from Eje Central, and Los Intangibles from Mexico. In English, they say,
published that seem to demonstrate the convenience of using ivermectin to treat COVID-19. One was done by authorities in Mexico, and the other is a review. And what is PAHO position on the issue? And Bennett Roche, yes, the same. If we have, what's our position related to the use of ivermectin, if it has successful results or not? Dr. Aldiguieri?
Yes, thank you, Sebastian, and to the two journalists regarding the ivermectin questions. Let me explain how we work on new therapeutics as we update our PAHO guidelines and review of potential therapeutics. It means that we review the state of the art of the scientific evidence. And these documents are available on our website for the doctors, for the medical associations, and also for the journalists. For doing this, we have been identifying evaluating, synthesizing different types of studies. However, it is important to flag that well-conducted, randomized controlled trials are the best evidence to evaluate the effectiveness of different interventions and formulate and update recommendations. So many studies have evaluated the effectiveness of ivermectin for prophylaxis and for prevention of complications. At present, regarding ivermectin, we have identified 28 randomized controlled trials that assessed ivermectin in patients with COVID-19. And only 11 of these 28 studies have reported on important clinical outcomes. Many of these trials had incomplete information and significant methodological limitations. Many trials enrolled few patients that resulted in far fewer events, leading to a substantially higher degree of uncertainty. 4 of these trials with fewer methodological limitations report no significant reduction in mortality, report no significant reduction of mechanical ventilation, including intubation, and probably does not improve time to symptom resolution. Ivermectin does not improve time to symptom resolution. Therefore, the WHO and the Pan American Health Organization recommend not to use ivermectin in patients with COVID-19, except in the context of clinical trials. The clinical management is focused on providing access to medications and clinical interventions that are proven effective for saving lives as the pandemic evolves. I hope I have answered the concerns of both journalists. Thank you.
Gracias, doctor. La próxima pregunta es de...
Sir, the next question is from the Charlemagne.
Pregunta, does PAHO recommend changing entry protocols for fully vaccinated individuals? Dr. Ugarte.
Thank you. That is a very important question because it applies to several countries, although unfortunately not many people in the Latin America and the Caribbean have received the vaccines. Still, there are many people that got fully vaccinated, and after the 2 weeks after the last doses, they may get protected from severe disease or dying. It is clear that the vaccine does not protect from getting infected, although there are increased evidence that that is the case in a significant proportion of persons who get vaccinated. Still, there are many people that will still get infected, and by reducing the protective measures of the persons who get vaccinated, of course, there is an increased probability and risk of getting infected and passing the disease to others that have not get vaccinated yet. So in that regard, the WHO and PAHO do not recommend to change the entry requirements for the people who got vaccinated. And there are another aspect also, is how can we discriminate or separate the persons who have been vaccinated from the other ones that get vaccinated. And also, if you are, for example, in a community where some people got vaccinated, how can you identify those and let them, for example, reduce their protective measures? So in that regard, there is a clear indication that unless the significant proportion of persons got fully vaccinated and protected, some of those protective measures must continue to get in place, and there is no change in the restriction or reduction of the restriction for vaccinated people to get to international travel. Thank you.
Gracias. La siguiente pregunta en inglés dice,
The next
what
question is,
PAHO think about the U.S. plans to send an additional 20 million doses of U.S. coronavirus vaccines abroad? And are these going to go to the Americas? Doctora Etienne?
Thank you for that question. Of course, as we have said time and time again, the Americas have been the epicenter of the pandemic for far too long. And what we've seen is the overburdening of our communities and our health systems. To this day, we are still the region with the highest mortality, even as other parts of the world are heavily affected. Vaccines are essential for us to save lives now and to prevent future outbreaks. So of course, while we are working with COVAX and manufacturers to get more supplies and expedite deliveries of the vaccines that are available, we know that that will not be enough. So of course, we welcome any initiatives to donate excess doses for our countries. And we are ready and able to deploy these vaccines. And so it is my fervent hope that the US, as one of our member states, will help fill the access gap that is existing in our region by donating vaccines to the Americas. Of course, there are other countries, including Spain, Sweden, New Zealand, and France, that have also indicated that they will donate excess vaccines through COVAX particularly. And of course, we would welcome some of those vaccines as well. The harsh reality is that in most Latin American and Caribbean countries, COVID-19 vaccines have reached less than 4% of this country's population, which is really a far cry from the 70% or more that we need to protect our people. So, as I've said before, vaccines can be the difference between life and death. And COVID-19 vaccines, we are sure, should not be a privilege of wealthy nations or people, but a right for all. It is a public good. And President Biden said it well earlier this week when he acknowledged that, quote, America will not be fully safe until the pandemic is under control. And that's especially true for this region where economies and communities are closely interconnected and with the United States. So while we are looking at ways to boost our manufacturing capacity in the Americas, understand that this is a long-term plan. We need a short-term solution to the problems of vaccine inequity, especially during the current shortage. And of course, donations are one of the possible immediate solutions. And we welcome that. PAHO is committed to the goal of bringing vaccines to those who need them, regardless of where they live or how much they can afford. We must work through every possible avenue to break down the barriers that prevent more vaccines from reaching our region.
Thank you, Dr. Etienne. Siguiente pregunta es de Lioman Lima.
Question is Oman Lina from BBC. And some countries of the region recently have begun administering candidate vaccine under study, and efficacy and safety has not been proven, and we have not seen results published in scientific journals, and we have not seen EUL usage. So what is the position of PAHO vis-a-vis this situation, and at what point in time would PAHO recommend the candidate vaccines for massive use in populations, and what measures could the organization take if the government or health authorities do not follow these recommendations under certain parts of the process? Dr. Barbosa. Yes, I will begin by the end. Each government has sovereign decision of what happens in the country. PAHO and WHO, we are not a force that can ban a government from adopting or hinder the administration of some measures by governments. But it is clear to us that when it comes to safety of the vaccines, we follow the international standards followed by all vaccines and all drugs to be able to make sure that before the use of the vaccine goes in, we conduct the necessary study in the labs, in clinical trials, phase 1 and phase 2 and so forth, just to make sure that the vaccine is safe. So we go through stages with a limited number of volunteers, and then from there we go to phase 3, and there you can have 20,000, 30,000, or 40,000 people that participate in phase 3. And then there we can evaluate in a better way the safety and the efficacy of any vaccine or any drug. So that's international standard. And that's the standard that was established by WHO. Is the standard that we follow and what we recommend so that we can use the vaccine in the population. Regulatory authorities in each country have their own standards and rules. But then in general, those are the stages that we have to follow before we administer vaccination to the population, because vaccines so evaluated can tell us how safe they are once they go to the public. So all the regulatory authorities adopted faster services for evaluation of the vaccines. All the health services and health authorities that I know of have adopted faster processes for emergency use. This is different from the traditional evaluation and assessment project that can take a long period that can take a longer time. So we have gone through pre-qualification processes, but then we have now adopted faster assessment and evaluation processes. That's the EUL system. But then we cannot authorize the use of a vaccine if we do not comply with all these steps. In case of emergency, we have to search for faster processes of evaluation, but we cannot go without evidence for vaccines or drugs unless there is a global consensus of the processes and methods to have a certified vaccine that is safe and that is effective. Thank you so much. Thank you so much. The next question comes from Barbados.
Can you provide an assessment of the efforts to fight the pandemic in the English-speaking Caribbean and Barbados specifically? Dr. Aldigueri?
Thank you for this question regarding the Caribbean. The Caribbean is a mosaic of people, islands, and mainland countries, so are the patterns of transmission of the COVID-19 among these countries and territories. The unique situation of the Caribbean is that its economy depends on tourism, therefore on international travels. This is the most complex aspect of the response in the region of the Caribbean. And as in most parts of the America, the Caribbean region is facing a new surge of cases that started late 2020, early 2021. And starting with tourism-dependent countries and the resuming of non-essential travels, but also for the countries of the Guyanese Shield, the spillover of the Amazonian wave to Caribbean mainland countries. It is important to highlight that countries of the Caribbean during 2020 have used very efficiently public health measures, including lockdown and travel bans, for bending the curve. The countries of the Caribbean have also strengthened their surveillance systems, including the laboratory surveillance. All countries and all territories have implemented their own PCR diagnostic Many of them are using antigen rapid test as part of their strategy. In 2021, all countries of the Eastern Caribbean, including English-speaking Caribbean, have started rolling out vaccination response activities. This is an example that all countries in the region must follow. Regarding Barbados, the country which has reported as of yesterday under the international health regulations, 3,972 cases, including 47 deaths, has dramatically expanded its laboratory capacity using both PCR and antigen tests. Barbados has implemented a strong contact tracing program and is rolling out its vaccination campaign. As of 14th of May, more than 112,000 doses of the AstraZeneca vaccine were administered to the population of Barbados. It represents 39 doses per 100 people. And we have to note that in addition of these 33,000 doses of AstraZeneca vaccine have arrived to Barbados on the 11th of May through the COVAX mechanism. So, in conclusion, in this mosaic of epidemiological patterns, Caribbean countries and territories, including the Eastern Caribbean English-speaking countries, have experienced and have access to all the tools for bending the curve and saving lives. The combinations of public health measures and proactive vaccination is key for controlling the transmission of SARS-CoV-2, the virus of COVID-19. However, important issues should be tackled in the short term, including vaccine hesitancy and including some person refusal to be tested as contact of COVID-19 cases. So I hope that I have answered both the English-speaking Caribbean question and also regarding the situation in Barbados. Thank you.
Gracias, doctor. La próxima pregunta es de Kaylin Romero del Confidencial.
Next question is from Kaylin Romero from Confidential in Nicaragua, and she answers if there has been advances in sending COVID-19 vaccines to Nicaragua. Has Nicaragua reported how many people have been vaccinated against COVID-19? Dr. Ugarte. Thank you so much for that question. Nicaragua had reported the number of doses by risk groups, but the last report available indicates that they had vaccinated about 166,000 people, or they have applied 166,000 doses up to last week. Up to then, they had vaccinated people over 65 years of age with morbidities. And then in May, they indicated that health personnel will be vaccinated. We don't have any precise information about the number of health workers that have been vaccinated, but we hope that this information will be shared in time adequately with the population in Nicaragua and with the health workers of that country. Nicaragua has received, as you know, the first shipment of vaccines from COVAX, 136,000 doses through that mechanism, and we have not sent anything additionally after this, and we hope that through COVAX in the next few weeks, we will be able to report how many dosages we will be sending to Nicaragua. So we are coordinating this work with the immunization program in Nicaragua, and we're holding frequent meetings to try to support immunization, and we do hope that the information can flow adequately so that this support can be rendered in a better way and so that the first line health workers can be covered through the existing vaccines. Thank you. Thank you, sir. The next question has Dr. Irazota from Radio Monumental in Paraguay, and she says that the government of Paraguay says that Paraguay was one of the first countries that negotiated the acquisition of COVAX vaccines through this mechanism, and then in accordance with public health, 4,279,000 doses were acquired through this mechanism, and then last year, this was covered with a $66.8 million, but they say that Paraguay has only received 170,000 doses. So why this delay compared to the amount of doses received by neighboring countries? And when will Nicaragua receive the doses that have been bought? Thank you so much for your questions. Let me clarify how you assign purchases through COVAX. It's not PAHO's decision to put this country here or that country there. All the countries that participate in the COVAX mechanism sent their letters. Last year, they paid in advance, and it was one of the requirements to be able to order these doses. But the COVAX facility, which is directed by Gavi and WHO, established an independent committee to process the allotment of these doses. And this was done randomly. All the countries were assigned in accordance to an algorithm to ensure that the decision should not favor this country or that country. But all the participating countries were there, and so through this algorithm, they established an order for delivery. Other countries of our region, unfortunately, had a problem when they received their first shipment, because the manufacturer, at that time, AstraZeneca for the region, it was a manufacturer in South Korea, and then they had a problem in production, and then Paraguay and other countries saw a reduction in the delivery of the first shipment. Paraguay, I think, only received, I believe, 36,000 doses. But now we are working with other producers or manufacturers to be able to speed up the deliveries to make sure that we can deliver the 134,000 dosages. And this week, in coordination with the Paraguayan Ministry of Health, we have already confirmed the new shipment that, and then the payment for the third delivery will be sent to, and I think in the next 2 weeks, which is the time between the doses are assigned and they are sent. So all the countries of the region, starting in May and then at the beginning of June, will be receiving the same amount of vaccines in proportion to their population. With the exception of the small Caribbean islands that have a small population, we really cannot send a very small amount of dosages to a country. It's all commensurate to the size of the population. So yesterday and the day before yesterday, I was in contact with the ministry to fine-tune the administrative matters and to set a new date for the third delivery, which is 4,400 doses to Paraguay. Thank you. And the next question is from Katia Rojas from Panama, and she says, what is the reason for the situation that we have seen in Argentina, that we have had records of contagions and deaths, and in India? And what is PAHO's position about people vaccinated not wearing masks here in the United States? Dr. Alighieri? Thank you so much. The evaluation of the situation in Argentina, just as in many countries of the Southern Cone and in many countries of the Andean area, is that during the summer and the high movements of the population, vacation time have caused a relaxation of the observance of safety measures, including social distancing and other measurements. In Argentina, the national authorities and the provincial authorities have taken multi-sectoral actions to be able to respond to the situation, including in some provinces, operational responses, health services, including logistics such as the supply of oxygen and reinforcing the primary healthcare system, reinforcing the hospital care and access to inputs such as personal protection equipment, rapid tests for the detection of antigens to make a difference. Regarding the recommendations and the use of masks in vaccinated people, we have to be very clear as to regarding our indications. Each country has a different pattern of transmission, including the United States. But then what we have observed in this moment in most countries of Latin America and the Caribbean, we see still community transmission that is sustained in most countries. And then in many cases, I believe this is one of the topics, one of the comments made by Dr. Etienne. In many cases, the trends at this moment are clearly increasing. So within this epidemiological context, Latin America and the Caribbean, the recommendation of the wearing masks in the population, including vaccinated people, continues to be on. And I hope I have answered the questions of my colleagues. Thank you.
Thank you, Doctor. We are coming to the end of our session today. The next question in English reads,
position regarding several attacks to healthcare workers and ambulances that have been reported during recent demonstrations in Colombia. Dr. Etienne?
Oops. So thank you for this question about a very disquieting situation. We are very concerned that over the past 3 weeks, more than 140 incidents against the medical missions have been reported throughout Colombia. Data from the Red Cross, the Colombian Ministry of Health, and Civil Defense shows that most of these attacks have been in 2 parts of the country, and those are the focal points for the ongoing demonstrations. These attacks have prevented health personnel from fulfilling their life-saving work that is especially vital during the COVID-19 pandemic. And of course, those reports are worrisome, covering everything from threats, assaults, attacks on health personnel, to vandalism and looting of ambulances and other vehicles carrying health personnel, medicines, and other essential health supplies. The consequences couldn't be more dire, as these attacks reduce the availability of already limited medicines, equipment, oxygen, and critical supplies at a time when Colombia's hospitals are filled with COVID patients and that infections are on the rise. Each one of these attacks seriously endangers the health and the lives of COVID-19 patients who urgently need and rely on these medicines and supplies for their recovery, and the people who have been injured or affected by protests as well. We believe that it is unacceptable that after enduring more than a year of this pandemic, bearing witness to untold suffering and shouldering more responsibilities than ever before, that our health workers are being met with violence simply for doing their jobs. This must stop. These attacks are incompatible with our right to health and jeopardize the integrity, the mission, and the very purpose of health and humanitarian aid. PAHO calls for the protection of medical missions and humanitarian assistance from all kinds of aggression, whatever its origin or motivation. Each of us has a part to play. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Well, so this is the end of the session today, and I remind you that you can find more information on COVID-19 on PAHO's website, www.paho.org, and you can also continue to communicate with us through email. Thank you very much for being with us today, and we'll see you next week. Goodbye.